Okay, so what we're going to try and explain today is how to take the blood pressure correctly. So ideally, you want your client seated, with legs uncrossed, either feet on the floor or feet on the bar of the seat here. And again, ideally, we're going to take it on the left arm if possible. While we're taking the blood pressure, we kind of don't want the client to talk because that can kind of create a little bit more of a hypertensive result. So if we can just ask the client to stay quiet while you're taking the blood pressure, that would be really good. When we're applying the cuff, we ideally again want the tube to come down the inside of the arm so that there isn't any kinks or twists within the tube, because again, that will give us a false result. When we put the cuff on, you can slide it over your client's left arm here. Thank you. Just above the elbow joint here, and make sure that, like I say, the tube comes down the inside of the forearm here. Tighten the cuff down so you can roughly fit 2 fingers into the cuff here comfortably, okay? You can then plug it into the machine. Again, just making sure that there's no kinks in the tube, and then take the blood pressure reading. You might want to warn the client it might get a little bit tighter on the arm here, but again, try to keep the client quiet or not talking during the measurement. Once the measurement is done, this is tightening up here, the cuff is tightening up, you get a systolic and diastolic reading. What's good during a consultation is to refer the result back to the hypertensive table, so 120/80 being ideal, or 140/90 being hypertensive effectively. Once we've finished, you can show the result to the client and turn the machine off.